Hey everyone, let's dive right into this explainer by looking at a pretty startling reality. This is something Dr. William has observed over his 15 years in medical practice, and it's a pattern he's seen play out way more times than he can count. We're talking about situations where someone who has been razor sharp their entire life suddenly starts losing the thread of conversations, forgetting names, missing appointments, or maybe even getting lost on a drive home they've made 1,000 times. And almost universally, everyone around them just shrugs and writes it off as, well, they're just getting old. But as we're going to uncover today, that assumption is often dangerously wrong. To really ground us, let's look at a pretty sobering statistic. Every 66 seconds, another senior in this country is diagnosed with dementia. Put that into perspective. Just in the time it takes you to get through this explainer, about 10 more families are going to hear those devastating words. And understandably, it leads those families to immediately believe their loved one is just experiencing the inevitable, unstoppable decline of age. But take a look at the heartbreaking truth behind this quote. For so many of these rapid memory loss cases, the true cause was never age at all. It was quite literally a bottle sitting right there on the bathroom shelf. We're talking about everyday medications, stuff doctors prescribed and pharmacies filled without a second thought that carry a massive hidden cost to the brain. So today, we're going to count down the 9 specific medications that are most closely tied to this rapid memory loss. Section 1. The hidden dementia trigger. Let's take a quick look under the hood to see how this actually works. Okay, so to understand this artificial brain fog, we have to talk a little bit of chemistry. Many of these drugs fall into a category called anticholinergic. I know, it's a big, clunky medical word, but the idea behind it is actually super simple. When a drug is anticholinergic, it actively blocks a brain chemical called acetylcholine. Think of acetylcholine as the critical messenger your brain relies on to lay down new memories and keep you sharp and alert during the day. When you block this chemical, you are specifically starving the hippocampus. That's the small, seahorse-shaped structure in your brain where your brand new memories are filed away before they can be permanently stored. And you can really see the danger when you compare a 30-year-old brain to a 70-year-old brain. A younger brain is producing abundant acetylcholine, which makes it highly resilient to these blocking medications. It can take the hit. But as we age, the brain naturally makes less of it, so it's leaning heavily on every single drop it has left. That means a medication that feels entirely gentle and harmless to a 30-year-old lands incredibly hard on a 7-year-old brain, triggering these sudden memory slips and confusion that mimic full-blown dementia. Which brings us to Section 2, Everyday Pills, Hidden Risks. Let's start naming some names. Starting our countdown at number 9 is diphenhydramine, which most of us just know as Benadryl. People treat this little pink pill like candy for sleep or allergies, figuring, hey, it's over the counter, so it must be totally safe, right? While actually, it powerfully blocks acetylcholine. A 2023 study found that regular users have a massive 54% higher risk of developing dementia. The safer alternative here? Newer antihistamines like loratadine, sold as Claritin, which thankfully don't cross into the brain. Right below that at number 8, we have proton pump inhibitors, or PPIs, like omeprazole and Nexium, which people take for heartburn. By totally shutting down your stomach acid, they actually prevent your body from absorbing vital B12, magnesium, and calcium. When you starve neurons of those minerals, you get misfires that look exactly like early Alzheimer's. In fact, a 2016 JAMA study showed a 44% higher dementia risk for regular PPI users. A gentler alternative you could discuss with your doctor might be H2 blockers like famotidine, which you'd know as Pepcid. Moving right along, number 7 is oxybutynin, sold as ditropan and used for overactive bladder. The relief it provides is very real. But unfortunately, this drug slips way too easily right into the brain's memory center. A 2019 British Medical Journal study found a 49% higher risk of dementia for long-term users, and yet patients are almost never warned about this. Mirabegron is a newer alternative to ask about that doesn't block acetylcholine at all. Coming in at number 6 are specific statins, like simvastatin. Now, we all know they lower cholesterol to protect your heart, but remember, your brain is close to 60% fat. It actually needs cholesterol to insulate its nerve signals via the myelin sheath. If you lower it too aggressively with statins that cross over into the brain, you get issues. A 2023 study points to a 26% higher rate of mild cognitive impairment. Pravastatin and rosuvastatin are generally considered safer choices simply because they don't cross into brain tissue nearly as easily. Now for Section 3, Mood and Sleep Medications. This is where the risks get a bit more intense. We're entering heavier territory here at number 5 with benzodiazepines, your lorazepam, diazepam, and Xanax. This is a tragic one because the chemical brain fog they cause is so often misdiagnosed as just a worsening of the patient's psychological condition. They do boost calming signals, but over time, they create this slow chemical sedation of the entire brain. Learning slows down, mental flexibility drops, and a 2022 BMJ study found that long-term users had a 51% higher risk of developing Alzheimer's disease. Buspirone or even specialized talk therapy can be brilliant alternatives that don't cause that cognitive clouding. Next up is number 4, amitriptyline. It's an older antidepressant that's widely used for nerve pain and migraines. But beneath all that versatility, it carries one of the absolute heaviest anticholinergic burdens on this entire list. It blocks memory chemicals so aggressively that a 2015 JAMA study showed a massive 54% greater risk of dementia with high cumulative exposure. Memory loss literally stops being a rare side effect and becomes an expected outcome. Options like duloxetine or gabapentin might give you that same nerve pain relief, but without the heavy cognitive cost.
Number 3 is paroxetine, commonly sold as Paxil. I want you to pay close attention to this one. It's an SSRI for depression and anxiety, which sounds modern and gentle, right? But it is uniquely dangerous among SSRIs because it is the only one with strong anticholinergic activity. Seniors taking Paxil are 30% more likely to show early signs of cognitive impairment compared to those on other antidepressants. Switching to something like sertraline is often a much safer route. And number 2 is perhaps the most deeply concerning on our list. Antipsychotics like quetiapine and risperidone. These were originally approved for severe conditions like schizophrenia, but now they are frequently prescribed completely off-label to older adults just to help with sleep or mild agitation. They suppress dopamine so severely that patients often appear emotionally flat, dull, or just chemically erased. A 2022 Lancet study showed a staggering 71% greater cognitive decline in seniors given these drugs. A lot of times, simple non-medication routines, like tweaking the lighting, reducing noise, or finding hidden pain, can manage behavioral symptoms without erasing the person's personality.
Section 4. The ultimate culprits. Polypharmacy. So what exactly is polypharmacy? Well, it's not a single villainous pill. It's the slow, hidden pileup of multiple anticholinergic medications being taken all at the same time. Let's imagine a pretty standard medicine cabinet for a senior. They take Benadryl every night for sleep, they take oxybutynin daily for bladder control, and they take amitriptyline as needed for a little nerve pain. By themselves individually, each might just cause a barely noticeable fog, but take them all together, they silently multiply that blockage of acetylcholine from several directions at once, creating this massive compounded burden that literally shrinks neuron connections from underuse. Just look at the massive spike on this chart. It brilliantly illustrates the true danger here. While individual drugs raise your dementia risk by roughly 40 to 50%, the compounding effect of polypharmacy spikes it to a staggering 120% over 10 years. That data comes from a massive 2022 study in Age and Aging that tracked over 280,000 older adults. That is more than double the normal risk. And the wildest part? The overwhelming majority of these folks had absolutely no idea their prescriptions were doing this to them. Finally, Section 5, reversing the cognitive decline. Let's talk about the path forward. If you're mentally scanning your own medicine cabinet right now and feeling overwhelmed, just take a deep breath, because the most hopeful takeaway from this entire explainer is that, unlike true Alzheimer's disease, this specific type of cognitive decline is often highly reversible when you catch it early. Your brain is amazingly resilient once you remove the source of harm. However, and I really need to emphasize this before you even touch a single pill bottle, never stop a medication abruptly on your own. Doing that, especially with drugs like benzodiazepines, can cause life-threatening withdrawals, intense anxiety, agitation, and extreme insomnia. It basically makes the drug feel absolutely indispensable right at the moment it's harming you the most. Instead, the solution here is structured and safe. Step 1, look out for the signs. Are you seeing unusual brain fog, forgetfulness, or an emotional flatness that seem to start after a new prescription? Step 2, request a comprehensive medication review with your doctor or pharmacist. Step 3, ask them to explicitly calculate your total anticholinergic burden using medical scoring tools. And finally, Step 4, work with them to gradually taper down and introduce safer alternatives. Trade the Benadryl for Claritin or the Paxil for sertraline so your brain can actually have a chance to recover its clarity. So the single most crucial point I want to leave you with today is that you have the power to protect your mind, or the mind of someone you love. Go check your medicine cabinet tonight, read those labels, and ask yourself, which of these prescriptions are you going to be discussing with your physician this week? Taking that one single step might just be the absolute most important thing you ever do for your long-term cognitive health.